Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Depersonalisation and Derealisation, Part 1. Introduction. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM, depersonalization, derealization, is the feeling of being separated from oneself and experiencing one's environment as unreal. It is a disorder in which the patient spontaneously complains of the experience that his own mental activity, his body, his environment, or even all of them are qualitatively transformed in such a way that they have become unreal, distant, or mechanical. The patient may feel that he is no longer the one who governs his own activity of thinking, imagining, or remembering, that his movements and behaviors are somehow alien to him, that his body seems devitalized, that his environment seems to him lacking in color and life, as if it were artificial or as if it were a stage on which people play predetermined roles. In some cases, the patient may feel that he or she is watching him or herself from a distance, or as if he or she were dead. The complaint of a loss of feeling is the most frequent among these various phenomena. The number of patients suffering from this disorder in pure or isolated form is quite significant. In general, the phenomena of derealization, depersonalization appear in the context of depressive, phobic, and obsessive-compulsive disorders, OCD. Elements of this disorder may also occur in mentally healthy individuals in states of anxiety, fatigue, sensory deprivation, hallucinogenic intoxication, or as a hypnagogic or hypnopompic phenomenon. The manifestations of depersonalization, derealization disorder are similar to the so-called borderline death experiences that accompany extremely life-threatening situations. Guidelines for diagnosis. A. Depersonalization symptoms such as the patient feels that his own sensations or experiences have become detached from himself, distant or alien, lost, etc. B. Symptoms of derealization such as objects, people, or the environment seeming unreal, distant, artificial, faded, devitalized, etc. C. The recognition that this is a spontaneous and subjective change and has not been imposed by external forces or by other people. Adequate awareness of illness persists. D. Clarity of sensorium and evidence that it is not a toxic confusional state or epilepsy. Derealization. Derealization is a natural symptom of an anxiety disorder, which is part of the mind's natural defense mechanisms against trauma and shock. Derealization protects from reality and makes one feel as if oneself and the world are not real. When a patient is in the midst of a genuine trauma, such as a serious accident or catastrophe, these defenses can save his life or his sanity by protecting him from traumatic events until he is over the worst of it. You can often read statements from people who say, "It didn't seem real, it was all unreal," or "I was moving as if I was in a dream." Derealization has many facets. The following symptoms, feelings, are the most common among our patients. feeling of being distracted, feeling of being dazed, feeling of being absent-minded, feeling of looking through a grey whale, sensory impairment, feeling of being in another world, feeling of being in a fishbowl, sensation of being behind glass, feeling of being in a dream, feeling isolated or distant from the immediate environment, being like spectator of a strange and meaningless game, perception that objects appear diminished, depressed, feeling as if you were in a cartoon series, feeling that everything seems artificial, sensation that everything seems unreal, as if the head were inside a bottle, seeing the world through the thick glass at the bottom. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Depersonalisation and Derealisation Part 2. Remember, with the description of this video, you can find a link to free training classes on clinical hypnosis. And also, you can download sell ebooks also free. If you have any questions, add them in the comment area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.